Good evening. I just want to talk a little bit about COVID tonight. And let me just start off by sharing some data on the most current numbers that we know. So, I'm making this video. Today is April 1st. As of today, we have over 200,000 cases that are been positive for COVID in the United States, and over 4,500 people that have died from the illness. There have been a lot of facts out there. Everyone is talking about collapse of the healthcare system, and there's been a lot of fears and anxiety. So I just want to speak to that in today's video. One of the resources I was reading earlier, it talked about 25 to 50% of people spreading this disease as being asymptomatic. And there's just been a lot of different information out there. So I just want to make sure that I maybe provide some just simple facts and just kind of how this disease spreads. So let's talk about a lot of questions that we've been getting here is, if it's safe to go outside, if it's safe to go to work, if my coworker is coughing, can I be around them? Do they have COVID? Anybody who's coughing and sneezing during this time is certainly going through a lot of stress to them and their coworkers and to their family, because no one really knows whether they have it or not. And some of the symptoms have been mild symptoms, and we don't really know, if those folks have been are positive for COVID or not. And as I said earlier, we are finding out more and more that maybe perhaps more numbers than we know that are positive, that are spreading the disease, are asymptomatic. The word asymptomatic just means like anyone like you and I who has no symptoms. There's not coughing, not sneezing, okay, no fever, and potentially could be a carrier and is spreading the virus. Okay, so some of the common questions are, can I go outside? Can I go to the grocery store? Can I be around my family? What if I have it? Can I be around my kids? Is it safe to be around my spouse? All those kind of things. And in addition, when we suspect that somebody has been around someone who's positive, what should we do about them? So I'm going to talk about, some of the things that, we've known so far about the disease, and maybe perhaps talk about, protection and transmission and whatnot. So let me just start off by, what we know about COVID-19 and the transmission process. So if you asked me about 3 to 4 weeks ago about COVID-19, I would have probably told you, just like most other people have been sharing information, that this is probably a disease that's going to be more like a mild to moderate case of the flu. Most folks are going to be affected heavily, that will either require ventilation or assisted breathing, or maybe suffer more high risk of complications, are going to be those greater than 65 years of age. And that was kind of the thought process. As you look at more data from Wuhan, from Italy, now from New York City, we're seeing that COVID-19 doesn't really differentiate whether you're 65 or more, whether you're 20 years of age or more. One thing that we have seen so far is that it has not really affected those folks that are, or I should say adolescents, 18 and under. Most of the cases have been, folks in their 20s and their 30s, 60s, 50s. And it doesn't matter what what age bracket you're in, but you could be 25-year-old and it still require ventilation. It still require assisted breathing, as a result of SARS, or severe acute respiratory syndrome, related to COVID-19. So let's talk about transmission. So the one thing that the CDC has talked about, that has been discussed in several articles, but we've also seen in a lot of in how this disease has spread in other countries, is that the transmission of COVID-19 requires sustained contact And what does that mean? Sustained contact means being in contact with someone, okay, within 6 feet of distance at least 15 minutes, okay? We've talked about also about this disease being transmitted through droplets as well as airborne. And I want to clarify a little bit more about what airborne means, okay? Because to a lot of people, airborne would mean that, this is transmitted through the air. So if I'm walking into the grocery store and someone who has COVID has just walked through aisle number 8, and I'm walking through aisle number 8, that I, potentially could get it. Well, that's not entirely clear. Okay, there are some resources that have said that the virus could be in the air for up to 3 hours, maybe up to 12 hours. But we don't really know, how accurate that is. One thing that we do know, that for airborne transmission to happen, it needs to be persistent. It also depends on the quantity of the particles and the amount of time that you've been exposed to. So 3 elements I want to talk about: quantity, okay, of the particles, time of exposure, and distance. Okay, so the CDC says less than 6 feet for you to have sustained sustained contact, in at least 15 minutes. Okay, the size of the particles matter. Okay, so when we're talking about the particle of the COVID-19. Okay, there's a lot of articles that tell you, that we believe that it's this size versus that size, or it ranges from this. But one thing that we do know, okay, is that these particles, when they are emitted, when somebody's coughing or sneezing, or they're talking to you, and while they're talking, they're spitting in the air. Okay, these particles, when they are emitted, they're normally emitted in either big globs or little globs. Okay, so when the particles come out, okay, the particles of the virus, they're going to be encased in either saliva, mucus, water, and if they're in big globs, they're going to follow gravity. They're going to land on a surface. They're going to bounce off, and they're maybe cause a little bit of aerosolization in the immediate surroundings. Okay, if they're small particles, okay, they're probably going to end up staying in the air for an amount of time that we don't really know exactly what that amount of time is. Okay, and then eventually settle down. Okay, so if you walk into a grocery store, okay, and somebody who is positive for COVID that shouldn't be outside has just sneezed into the air, they're not wearing a mask, and you just happen to be walking through that same aisle, could you potentially get it if you're not wearing a mask? Sure, you can. Okay, so is there any benefit from wearing a mask? Absolutely. Okay, for that person that may have the disease, they should have a mask on. For you, if you're asymptomatic and you don't know if you have the disease or not, you probably should have a mask on as well, just to protect yourself of the possibility that some small globs of are in the air. Some particles are in the air to a certain amount of time, and you should protect yourself that way. But one thing I do want to say is that this virus, we've only known about this for the last 3 months, right? 3 or 4 months, since December. And no one really knows exactly a lot of details about it. But one thing that we do know is that there's a lot more data released every day. There's a lot more numbers, and it's just becoming more and more scary. But what can we do, and what right now that we know that would protect us and protect our loved ones? And in all honesty, in my opinion, for someone to say that after 3 months we know exactly how the virus behaves, we know exactly how it spreads, how it goes from one person to another, is probably a little excessive. I would say maybe even a little arrogant in a sense. There's not a whole lot that we know about this. It's only been a very short period of time. If you even think about the flu, the flu changes every year. Every year you got to take we recommend the flu vaccine, but again, that comes from a lot of changes that happen to the virus from one year to another. So this is a novel version of the coronavirus, okay, meaning it's a new version of the coronavirus that normally causes the common cold. But the new thing about this is that the human body has not experienced this before. So we don't know how, the human body responds to it. Specifically, we don't know how the lungs respond to this novel version of the coronavirus. So, talked a little bit about transmission here with droplets, okay, and airborne, okay, probably more droplets, probably more contact. So one key thing that CDC talks about heavily is hand hygiene. So what does that mean? So anytime you're touching anything, okay, is it okay to touch the doorknob? Is it okay to use the bathroom that somebody else used? Absolutely. Okay. Just make sure that your hands are not touching your face. That's going to be the point of entry. Okay. So what you got to do? Remember your hands. You got to have clean hands. So if you're going to touch doorknobs, that's okay. Make sure you wash your hands before you do anything else. Okay. So hand hygiene is absolutely important in this situation. Probably even more important than wearing a mask, okay? And I'll go as far as to say that, probably even more important than wearing a mask. Hand hygiene is extremely important. We're probably seeing a lot of transmission through droplets, through contact. We're touching things that we're touching our faces. You might even think that, children are, the reason why schools are closed at this time, because if children are carriers, they tend to be a vehicle that spreads this illness and that goes around very quickly. And, so there's wisdom in closing schools and saying that, we're going to limit exposure. We're going to limit, kids that tend to be a pretty common vector, for most viruses, hoping that we can maintain social distancing, hoping that we can maintain good hand hygiene, hoping that we can, isolate folks that perhaps are symptomatic or perhaps are, don't need to congregate in areas in large groups. So transmission we talked about, hand hygiene we talked about. I want to talk a little bit about the masks. So there's different kind of masks. So there is, the common, this is a common ear loop surgical mask. This is the mask that most of us are going to be wearing, right? You want to make sure that it's tight around your face, that you're not getting a lot of gaps, okay, over here. Is that 100%? Absolutely not, okay? But if we're talking about droplets, okay, big globs versus small globs, people that are coughing and sneezing in the area, what does it mean to have this on? Does it do anything? I just kind of wanted to maybe demonstrate this with this spray bottle here. Let's say you're using a Windex or something like that. So if somebody's sneezing, okay, and I'll just kind of demonstrate what that looks like. I don't know if you could see this, but if somebody, if this is like in front of me, depending on the size of the particles and depending on the amount, okay, that's gonna impact how much of this I'm gonna get into my system. Okay, so let's say you've got this mask on. Is it 100%? Absolutely not. Right? Is it doing anything? Well, yes. Okay, so if you've got symptoms, this is protecting you and protecting other people from anything that you potentially could be passing around. Okay, it's also a statement of saying, hey, I'm taking this seriously, to the level of, I care that if I were to have symptoms, I want to make sure that you don't get what I have. And I also, want to protect myself if you were to have symptoms, but you don't know about it. Are we testing everybody? Absolutely not. We're not. Why? Because this is part of the challenge, is that we're not able to test everybody. How quickly this virus is spreading is not allowing us the amount of time needed to develop the proper testing, to have the proper PPE to protect ourselves when we're testing, and to reduce how quickly it's spreading. So we cannot test everybody. We cannot test folks that are asymptomatic. We just have to make sure that if you have symptoms, okay, follow the guidelines of the CDC, stay at home, isolate, make sure that you're keeping your distance from your family at least 6 feet. You're not spending, 15 minutes or so around your family members in close proximity. Make sure you're alternating use of spaces. So these are key elements that you got to focus on. Okay, as far as using masks, right? Besides this being you're protecting yourself from exposure to particles, but also you're telling other people that, okay, you care about them, that you may be a carrier, and then you're protecting them as well. Okay, it's also a tool to just help us remember that when I have this on, okay, I'm going to try my best not to touch my face. Okay, and for me, habitually, I tend to, lean on my face. Maybe I'll scratch over my eyes, that kind of thing. And a lot of us do that kind of thing without even thinking. But when you have a mask on, it just kind of helps as a reminder. When you go to touch, you realize, oh, there's something on there. Okay, I shouldn't be touching my face. Or are my hands clean? I should go get my hands washed. So, there's an element in using the mask that provides a great deal of benefit. There have been some articles that I've read about, using the mask, every time that you're putting this thing on and off, right? You're potentially, if your hands are not clean, you're touching your face. And if you're touching your face and your hands are not clean, well, you're increasing your exposure risk. Well, absolutely, right? So if you're going to wear a mask, make sure your hands are clean, right? And if your hands are clean, well, there, you're actually, then you can actually benefit from using this thing. And again, we know that masks are in great shortage. Some people have talked about making their own masks, and we've had questions about well, what should I use? What if I don't have this? Well, there are some resources that are saying that, if you use a t-shirt, it actually would block about 70% of particles. Okay, well, that's not as high as what a surgical mask would do, or maybe what an N95, which folks at the hospital are using. But even though it's not as high, but at least it's something. It's a protective barrier. We don't know the exact size of the particles that will be floating around, that are potentially airborne transmitted, right? But what we do know is that if you protect yourself, right? If you got something on, you're protecting yourself from most things that could enter. You're reducing your chances of being exposed. So that's the thing about these surgical masks. So I'll just talk a little bit quickly about the N95s. The N95s are going to be mostly preserved for folks that are doing procedures in a hospital. Things that are going to cause what we call aerosolization of the virus. What does that mean? If you're somebody that works at a hospital, if you're going with a patient, you're going to do some kind of procedure that causes them to cough, like an intubation, or you're sticking something down their throat that's going to make them cough or sneeze or that kind of thing. That's the kind of thing where you need an N95 for. Okay, for the majority of us, we do not need an N95. One of these simple masks is sufficient enough to protect us. So first responders, okay, if you're doing, CPR on somebody, if you're intubating somebody, you should have an N95 mask in addition to, to all the rest of the proper PPE, eye protection, gown, gloves, everything as the CDC recommends. However, for the general public, a regular mask is sufficient to use. So I talked about transmission. I talked about hand washing being extremely important. We talked about the masks. Let me see what other questions we've been getting here in our clinic. Return to work. A lot of people that are, coughing a little bit. Well, it really depends. If you're a first responder, as of the 24th of March, the CDC has recommended that if you have an upper respiratory illness, that you get tested for COVID. Again, it really just has to do with the type of work that you're doing. So we want to make sure that we're not spreading this out to other people, because you're essential personnel. Testing is recommended for first responders if you have upper respiratory symptoms as of the 24th of March. As far as return to work, if your test comes back negative, okay, essentially you can stay home until you're better, and then you can return. Okay, if you are not tested, the recommendations is to wait at least 72 hours from when your symptoms have resolved, okay, in addition to at least having 7 days from the onset of your symptoms. Why 7 days? Because the average person that gets COVID normally gets better within 7 to 14 days, but 7 days is about the average for most people, that get the illness. I talked to you guys about asymptomatic spread. Again, that's kind of one of the biggest things that causes a lot of concerns for people. That if I don't have symptoms, could I be positive and could I be spreading it? Well, sure. Okay, some people don't have symptoms at all. Some people don't have symptoms for the first couple of days. They are still contagious. Okay, does that mean be afraid of everybody around you? No, right? Because we talked about how it spreads. We talked about droplets, which means clean hands. We also talked about airborne transmission. Okay, that has to do with the quantity of the particles, has to do with the time of exposure, has to do with the size of the particles. So all three factors are going to affect that. So if somebody's asymptomatic and they're around, okay, just because you're standing next to them doesn't mean that you're going to get it. Okay, you have to kind of think about the glass or the Windex sprayer example. If somebody's sneezing around you in the area, absolutely be careful. Make sure you got your mask on. You don't know when somebody's going to cough or sneeze, so make sure you've got a mask on. Okay, if you've got a weakened immune system or you take any medications that potentially could weaken your immune system, I would say probably be very vigilant. Maybe think about the areas that you're gonna go out to, your exposure. Okay, and if you have any questions, please call us. I'd be happy to discuss like what things we can do to reduce your exposure during this time. Okay, let me see. What other things do we want to talk about? Some people have asked about, what if you get tested and then your test is negative and then you come back, could you potentially test positive? Well, there's a lot of elements. There's a lot of factors that will affect this. So, the type of tests that are being done. And right now there's probably a lot of advertisements about maybe doing some home testing kits because, you don't want to go to an ER or a busy urgent care center and to get tested when you might be exposed to other people. You don't even know if you're positive or not. The one thing that we do know is that, there are factors that are going to affect the quality of this test. Okay, and there's the home test kits that are out there right now and are entirely well studied to say how accurate they are. It also depends on how well the swab is collected. Okay, so there's different elements that are going to impact that, and at this point, as of April 1st, I would tell you that we don't really have enough information to say whether the home tests are good or not during this time to rely on. But regarding as to whether somebody could potentially test negative and then again test positive, well, that's a possibility. But as of right now, the recommendation, if you've tested positive, okay, you waited the 14 days and then you've tested negative, okay, you may return to work with a mask on. Okay, that's because there's a possibility that maybe you didn't clear the entire viral load from your system. Okay, and perhaps the results were negative on day 14 or day 20. Okay, that's when you didn't have any symptoms, but you're still carrying the virus. So it kind of puts you in the, maybe you're asymptomatic, or don't have any symptoms, but you could potentially spread the virus. So as far as the way the virus works, what we understand at this point is that once you get it, your body is going to build immunity to it, as far as having like a second recurrence or a second wind of the virus, I don't know if that's entirely founded, but maybe perhaps what makes more sense is that you have not cleared the entire viral load from your system. Let's see. When to go to the hospital. Okay, so that's a big one. So if you've got a fever, okay, for the majority of folks, stay home, okay? Call off work, call our centers, but stay home. You do not need to be out in the public. If you got upper respiratory symptoms, cough, sneezing, whatnot, same thing. Stay home, call us. Let's figure out what's going on. Let's figure out how to best assist you and as far as to what next steps to take based on your risk factors. For folks that maybe have some symptoms, but in addition to that, they're also short of breath, okay, whether at rest, so meaning you're sitting on the couch and you're short of breath, or you're going upstairs or you're walking, to and from your bathroom and you're getting short of breath, that's probably a sign that you should go to the hospital. Okay, does that mean that you're going to die if you're short of breath? No. Okay, the majority of people that end up going to the hospital, if they're short of breath, they may require assisted ventilation. And if they do, most of them come off the ventilator and survive. Okay, the folks that are dying from the illness are probably, the same people that have higher risk factors, okay, to predispose them to SARS or severe acute respiratory syndrome in this case. Anyways, I don't want to take a lot of time, but what a lot of questions here. I just wanted to maybe answer some of them, maybe provide some guidance. I know this thing is, for a lot of people, it's kind of annoying, and putting this on is kind of like, you put this on and automatically people think, well, you got COVID. What business do you have going on in the public? And why are you even wearing this thing? That's not the case. We need to change that. Okay, we're wearing these masks to protect ourselves and to protect other people from what we may be carrying. Okay, and that's what these things are for. Okay, you don't need a whole lot of them. You don't need a big box of these. All you need is a few. Okay, you can reuse it. The CDC has some recommendations. Okay, this is the front of the mask. Okay, you can clean the outside part. This is the inside. You can clean the outside of the part and you can reuse it. Okay, you can put it back on. All right, so masks are important, but most importantly, hands. Make sure you got clean hands. So hand hygiene, anytime you're touching anything, you've got to train your mind. Okay, train your mind. It's going to be a reflex. If I touch something, okay, I'm not touching my face. I need to wash my hands. Okay, so again, even though there's a lot of information out there, what I really want you to know that, as scary as this may seem, okay, there are very simple things that we can do together to really reduce the risk of spreading this illness. Okay, wearing a mask, washing hands, calling, your provider, calling the wellness center, asking questions about what to do. We're here for you. We're here to support you. And please be safe. I know personally, I am making this video, from home, because last week my wife, who was exposed around a patient that is a potential suspect for COVID, she was required to stay home. She was required to get tested. Because of that, and because I'm exposed to her, I am now required to be at home until she is positive. So again, I don't have any symptoms, but you got to do the right thing. She's staying home. She's got to put a mask on. She's isolating. We're here to again, know that this is bigger than what we currently know. However, as scary as it may seem, and as much information that we're all hearing that is very unclear and keeps changing from day to day, there are very few and simple things that we can all do that I wholeheartedly believe will reduce the burden of this illness. Okay? Please call us if you have any questions. I'm Dr. Rizk over at Fauquier County Employee Wellness Center, and our number is 540-905-7456. We still have the same hours as before, and we're just happy to help. So if you've got any questions, let us know. Please be safe and stay well, and do the right thing for you, for your family, and for the entire community. Thanks so much.